Good morning. I'm joined today by Dr. Dean Seidlinger, our state epidemiologist, Dave Baden, Chief Financial Officer at the Oregon Health Authority, Colt Gill, Director of the Oregon Department of Education, and Dr. Dana Brainer, Physician-in-Chief at OHSU Dornbecker Children's Hospital. Happy Rosh Hashanah to everyone celebrating today. We wish you a happy and sweet New Year. Following the Labor Day weekend, we're here to give an update on COVID-19 and our next steps in fighting the Delta surge. But first, I wanted to take a moment to acknowledge that today marks 1 year since the devastating Lions Head, Beachy Creek, Holiday Farm, and Alameda fires. The Labor Day 2020 fires destroyed homes and ravaged communities across the state, and together burned more than 1 million acres and thousands of homes. And unfortunately, we lost 9 Oregonians. This anniversary is traumatizing for so many Oregonians, especially with so much wildfire still on the landscape. I want to thank all the dedicated Oregonians, from the firefighters to local emergency managers to the Red Cross volunteers, and many more who helped fight these fires last year and now are focused on recovery. These folks, both paid and volunteer, put their lives on the line to keep us safe. We are incredibly grateful for their service. September also marks National Preparedness Month. I encourage all Oregonians to join me in honoring with action. Learn how you can prepare your family for wildfire and other emergencies. You can learn more at ready.gov. Moving to COVID, let me start with some promising news. Thanks to Oregonians doing your part, modeling is showing that we are successfully slowing the spread of the Delta variant. We're using the 2 most powerful tools that we have, vaccines and masks. Because Oregonians are masking up and continuing to get vaccinated, we have been able to cut the projected length of this surge. That is really good news. However, there's still some challenging times ahead, and we must remain vigilant. Every action you take impacts how this plays out. Dr. Seidlinger will share more, but let me take a moment to thank you all for stepping up. Every time you mask up, you're helping our doctors and nurses do their jobs. Every time you mask up, you're helping our kids return to school more safely. And every time you mask up, you're helping keep our businesses and our communities open. Thank you. Less than 2 weeks ago, I visited the ICU at Oregon Health and Science University. Our doctors, nurses, and healthcare staff are exhausted and continuing to work long hours. We are so grateful for their dedication and determination to save lives. We know that the overwhelming majority of patients in ICUs are unvaccinated. It was both eye-opening and gut-wrenching to put people's faces and stories to these statistics. I saw a young father on life support. He wasn't going to make it. And a pregnant woman who didn't get vaccinated because she was concerned about the safety of the vaccines for expecting parents. It is heartbreaking to see Oregonians on ventilators when vaccines have made hospitalization from this disease largely preventable. It's also a harsh reminder of the human toll this pandemic continues to have. By now, you may know someone who's gotten COVID, or worse, lost someone you love to the virus. I'm so sorry for your loss. COVID-19 is still very dangerous and unpredictable for those who are not yet vaccinated. With the FDA's recent full approval of the Pfizer vaccine, we have further confirmation that vaccines are safe and effective. If you still have questions, reach out to your healthcare provider or visit covidvaccine.oregon.gov. or speak to a vaccinated friend or family member about your concerns. Please do not let misinformation or questions stop you from protecting yourself and your family. Before I hand it over to Director Gill, it's with mixed emotions that we are welcoming our kids back to school this year. I know many parents are excited for kids to return to the classroom full time, and at the same time, anxious about the Delta variant. Director Gill will give an update on how we're working to make sure we have the latest possible transition back to full-time in-person learning, and Dr. Brainer will share some tips for parents and families. We all play a part in reducing community spread of this virus so our kiddos can have the best chance at a safe and normal school year. Please get vaccinated and wear a mask. Together, we can stop the Delta variant from spreading and keep our kids safe and learning in the classroom. With that, I'll turn it over to Director Gill to share more about back to school efforts in Oregon. Director Gill, the floor is yours.
Thank you, Governor Brown. Now, our children are now beginning their third school year impacted by COVID-19. Like adults in Oregon, our kids have experienced a lot of change and a lot of emotion over the past several months. Some of our children have experienced the loss or suffering of a family member or a friend due to COVID-19, and all of our children have experienced some isolation from personal connection with their peers and trusted adults as they transitioned to school online at some point last year. And last spring, most experienced the anxiousness of a first day of in-person school that came months late and included many new protocols to keep everyone safe. The good news is that we proved schools can be in session, in person, and still mitigate the spread of COVID-19. This is possible because schools are controlled settings. They are a place where we are all used to following rules to help keep everyone safe and to help everyone get along together. Last year, schools layered safety protocols like face coverings, physical distancing, cohorts, symptom screening, hand washing, and added ventilation that created a protection for everyone in the school setting. Individuals with COVID-19 did show up in our schools. They were caught early, and they rarely spread COVID-19 to anyone else in that setting. This year, we've set a clear North Star for our schools. It is a priority that our kids need and one that we have practiced and believe we can succeed in reaching. This year, we want all of our children to safely and reliably participate in school full-time, in person, every school day, all year long. Our children need this. Nearly all our children can learn better when they're taught in person by a talented teacher who can build a caring bond that leads to each child growing and learning beyond our expectations. Our kids also need social interaction. They need time with their friends and peers. This creates well-being and instills happiness. Many of our kids need the access to a solid breakfast and a warm lunch that's also offered at school. And many can benefit from the physical and mental health services available in our schools. Our schools are places of learning and care, and our kids need access again. This won't be easy, and it will take some sacrifice on the part of community to make this a reality for our children this school year. In recent weeks, Oregon has seen community spread, hospitalization, and ICU rates at all-time highs due to the highly transmissible Delta variant. If you are a student, a family member, an educator, or really anyone who comes into contact with school-age children, we have an ask of you. As communities across the state, we need you to do your part to protect this school year. As I shared, our schools are practiced. Our teachers, our administrators, bus drivers, office and kitchen staff, and all the others in the schools know how to implement these protocols. They are doing the work of heroes right now. Almost all the health and safety protocols a school will implement this year are in their hands. The state and our communities are placing our trust in local school leaders to consider physical distancing, ventilation, symptom screening, and so much more. You can see your school's plan on their website or at oregon.gov/readyschools. But our local school leaders need your cooperation and support so our kids can go to school and stay in school this year. COVID-19 is a real health threat. That is why there are a couple of universal requirements for the protocols that can keep our kids and their families and our staff and their families safe. We have statewide masking requirements. If you are around anyone outside your household, especially if they have school-aged children, please wear a mask. And we have vaccine requirements for our educators. They will be in indoor spaces with mostly unvaccinated youth for several hours each day. When you look at Oregon's case rates, our hospitalization rates, ICU rates, and sadly even our death rates, it is clear that vaccines work and that they are saving lives. If you are in a household with school-aged children and you are eligible for a vaccine, please get a shot and protect yourself. But even beyond protecting yourself, you'll be protecting your family members, your child's teacher and bus driver, and most of all, your child. These two statewide safety protocols and each of the safety protocols put in place by your school not only make it safer for everyone, but they also help ensure that our kids actually get to stay in school. While there are some serious cases, thankfully most children still do not get severe cases of COVID-19. However, their access to school is constantly under threat due to exposures to individuals with the highly transmissible Delta variant. Students come into exposure and then they're quarantined and they miss school time. The safety protocols that we have in place help reduce exposures, limit the impact of quarantines, and help keep our kids in school learning, playing, and growing. When eligible individuals vaccinate, they don't quarantine unless they're symptomatic. When people wear masks, they're less likely to be quarantined. When schools use physical distancing and cohort protocols, fewer students get quarantined. The better we adhere to the health and safety protocols in schools, the less likely we are to have students be quarantined and the more likely we are to have them stay in school. We've already seen a few Oregon schools close or delay the start of their school year this year due to student and staff quarantines or isolations this fall. These have been primarily from COVID-19 exposures outside of the school day. We all hold some responsibility for achieving this full-time in-person school year. The threat to losing school time or to moving back to online school is real, but I believe that we can do better than this. Because of the health and safety measures we have in place, our schools can be safe spaces for students and staff. We have proven it in the past, but we all have to take a part in making that statement true. The more we all do our part to limit COVID-19 spread in communities, the more we can protect our students in and out of school. Please make a small personal sacrifice to do what you can to make this school year a success. This means wearing a mask even when you don't want to, or getting vaccinated. These are small gives to support our children and Oregon's future. In fact, last week we released 5 straightforward back-to-school tips for families with kids that are heading back to the classroom. They're simple. Make a plan to vaccinate all eligible household members. Wear a mask in public and in carpools. Limit your gatherings with other households and move any of those gatherings that you do have outside. And make a plan in case your child needs to miss school. These are 5 simple steps that help protect the first month of school. Today, the Oregon Health Authority and the Oregon Department of Education also issued their first school health advisory. These advisories will include additional steps that individuals, families, schools, and communities can take to help us reach our North Star. Again, that North Star is ensuring that all of our children are able to safely and reliably participate in school full-time in person every school day all year long. These school health advisories may be regional or statewide, and they will change from time to time depending on COVID-19 conditions and what we learn about effective mitigation strategies. To maintain the continuity of instruction during the first month of school this school year, OHA and ODE are issuing the following 5 school health advisories. These are to remain in effect statewide from September 7th to October 1st, unless we update them otherwise. 1. All eligible youth and adults who come into contact with school-age children should vaccinate to reduce the spread of COVID-19 in the school community. 2. Families with school-age children and educators should limit gatherings and non-essential activities with people from other households to the extent that they can. And if you are visiting from people from other households, you should wear masks, maintain physical distancing, and keep your activities outdoors as much as possible. 3. To the extent possible, schools and other organizations in and around schools with youth should reduce extracurricular activities and consider holding such activities as meals, recess, PE classes, music, and choir outdoors to maximize physical distancing and ventilation. 4. Schools should hold all of those great beginning of the school year family events like open houses, carnivals, teacher nights online. If they can't be held online, if they must be in person, the participants should wear masks, maintain physical distancing of at least 6 feet, and hold those events outside. Finally, number 5, families should check your school's website or ODE's Ready Schools Safe Learners website to review your school's safe return to in-person instruction plan. That way you will know what all the protocols at your school are. Finally, I want to share that we have significant plans for this school year beyond our health and safety protocols. We want to make sure that this school year is all about care and connection. Our kids need opportunities to rebuild relationships with their friends and peers and their teachers, school counselors, and other school staff. Our kids also need time to process this last 18 months. They need to know that they are welcome and cared about in our schools. Our Care and Connection program is all about reconnecting with kids and school staff and showing them that we believe in them and that their feelings matter. We have asked all of our schools to start the year with a Care and Connection week. We have supplied them with activities for the opening week of school and throughout the school year. You can learn more about the project at your child's school or at oregon.gov/readyschools. There you'll find out what schools are doing for your children, but also activities that you can do at home, including information about how you can talk to your kids about COVID-19. We are schools, so I can guarantee that there will be teaching and learning as well. It's what we do, it's what we live for. But we are talking about taking a little bit of extra time to work through that back to school anxiousness and make sure that each one of our children know that they are welcome in our schools and that they matter in our hearts before we jump into reading, writing, math, art, science, and more. Even as we push through some of the darkest days of the global pandemic in Oregon, this fall can be a time of renewal for all of us. We can all be a part of making a return to in-person learning a success. Please do what you can by wearing a mask, getting vaccinated, and keeping physical distance from those in other households. This is something you can do for a child that you know and love. You can make their school year a success. Thank you. Governor Brown.
Thank you so much, Director Gill. I really appreciate your leadership. And with that, we're going to turn it over to Dr. Dean Seidlinger, our state epidemiologist.
Thank you very much, Governor Brown, and thank you, Director Gill. I truly appreciate the partnership between ODE and OHA as we continue to work together to provide safe in-person instruction to all Oregon students this year. The Delta variant continues to ravage communities across Oregon. Our hospitals are scrambling to avoid being overtopped by record numbers of COVID-19 patients. Daily cases and hospitalizations associated with COVID-19 have been hovering at or near pandemic highs over the past several weeks. Our most recent COVID-19 weekly report tallied 16,252 new cases, the 8th consecutive weekly increase That is 13 times higher than the reported cases for the week ending July 4th. But in some good news, the cases last week appear to be down slightly over the week prior. COVID-19 hospitalizations and intensive care unit admissions reached record highs last week before receding slightly. More good news. But those numbers remain alarmingly high. Our hospitals have reached the saturation point, where health systems are not able to provide care to everyone arriving at their doors. That means fewer beds for anyone who experiences a medical incident, not just COVID-19, but because of other medical problems, like a heart attack or injuries from a car crash. Needed surgeries and procedures are being delayed. It is the crisis we all dread, one that we must do everything to avoid. An overwhelming majority of the patients with COVID-19 filling these critically needed beds are unvaccinated. I cannot say this more plainly. This is a crisis that is largely being driven by people who have not yet been vaccinated against COVID-19. Unlike during the earlier days of the pandemic, we now have access to safe and highly effective vaccines. I urge everyone who is eligible for vaccination to take advantage of this life-saving opportunity for yourself, for your families, and your communities. Our newest modeling last week offered some encouragement, a slowing of the growth of cases and hospitalizations in the coming weeks. But that is conditioned upon more adult Oregonians getting vaccinated and taking other protective steps, such as wearing masks when in indoor public spaces, when we're outdoors amongst crowds, and reconsidering plans that put us or others at higher risk from getting COVID-19. The decisions we make over the next few weeks will determine whether we plunge deeper into the crisis of care or we reverse this rising tsunami. I recognize that the current COVID-19 outlook is a source of concern for parents of students returning to classrooms this fall. OHA has been working closely with the Oregon Department of Education to ensure that our schools remain well protected against COVID-19. We are confident that the safety protocols Director Gale has outlined will achieve the delicate balance of promoting the safety of students and staff and will minimize the risk of catching the virus in school and bringing it home. One of the most important tools that we have in our fight to contain the virus is the availability of COVID-19 testing for students and staff. Access to regular and reliable screening and testing can identify COVID-19 infections more quickly and help to slow transmission in K-12 settings. These include diagnostic testing for students or staff who display symptoms of COVID-19 or who may have been exposed to the virus while at school. This free testing can help diagnose infection early and shorten isolation periods. Weekly screening testing for unvaccinated K-12 staff. These tests are self-collected at home and are processed through a regional laboratory. Weekly screening testing of unvaccinated students through an opt-in program. Because COVID-19 vaccines are so incredibly effective in reducing the risk of infection, the CDC recommends screening only in unvaccinated individuals. Schools may choose to verify vaccination status, but it's not required. And all interested K-12 schools and students are welcome to enroll, regardless of vaccination status. I encourage every school to participate in these important testing programs. Schools must register for the 2021-2022 school year, even if they participated last year, and parents should encourage their children's schools to enroll. This is critical to accomplishing our shared objective of ensuring that schools can reliably hold in-person instruction every school day for all students, all year long. I want to conclude with a very special thank you to my public health colleagues and community partners who continue their hard work every day to help protect Oregonians from COVID-19, despite being physically and emotionally exhausted. We have been battling this virus for over a year and a half, combating misinformation, investigating cases, linking people to much needed services, vaccinated Oregonians, and so much more. Thank you. I extend my deepest gratitude to the healthcare workers who continue to provide quality care to Oregonians, all in the face of exhaustion, delaying needed care because of capacity, in the face of immense losses that they do not have time to fully grieve. To all Oregonians who are ill, worried about sick loved ones, or grieving the loss of a loved one, my thoughts are with you. To everyone who has taken the time and effort to get the vaccine and now to wearing masks, thank you. All of you who are taking steps to protect yourself and those around you, I'm truly grateful. Thank you. Once again, Oregonians are rising to the challenge. To people who have not been vaccinated, please make a plan and get vaccinated. You could save your life or the life of a loved one. Thank you. And with that, I'd like to turn things over to Dr. Dana Brainer.
Good afternoon. My name is Dana Brainer. I'm the physician-in-chief at OHSU Dornbecker Children's Hospital. For 32 years, I've cared for Oregon's sickest kids in Dornbecker's pediatric ICU. I've had the privilege of supporting Oregon families through their darkest hours and celebrating the incredible progress that their kids make throughout their healthcare journeys. It is my job, as well as my passion, to ensure the well-being of all children across our state. I am honored to speak with you today on behalf of Oregon's kids. The return to in-person school is essential, not only for our children's education, but for their physical and mental health as well. In 32 years, I have never seen a mental health crisis the likes of which I am seeing daily here. We need to combat that with all available resources, and in-person school is a very important one of those. As a pediatric physician, and also as a father, I understand the stress that this year's back-to-school season brings. As Governor Brown has stated many times before, the Delta variant has changed the game. After so many months of progress, Oregon is now engaged in a new battle, unlike anything we've seen before. Understandably, this may cause some parents to feel torn between their child's overall well-being and the risks of contracting COVID-19. While we know that severe illness in children with COVID-19 is unlikely, it is still possible that kids may transmit the virus to other vulnerable family or community members, and we are still learning about the longer-term aspects of COVID-19. This is why we must all, collectively, as a community, prioritize our kids' health and their social, emotional successes. We must all do our part to slow the spread of COVID and to give our schools and kids a chance. We know how to do this, and we have all of the tools we need to support a healthy system in the classroom and a healthy return. Getting vaccinated is the single best thing a person can do to prevent their own severe sickness and death and protect others from the virus, especially those not able yet to get a vaccine. Available vaccines are safe, they are effective, and they make COVID-19 a preventable illness. Both vaccinated and unvaccinated people who need to interact with the community in schools or otherwise should follow these 3 precautions. Wear your mask in all public spaces, both indoor and outdoors, when physical distancing is not possible. Not only will this help to protect you and your loved ones from COVID, but the risks of seasonal colds and influenza as well. Limit gatherings if possible, and if you do gather, please do it outside if possible, and physically distance whenever possible. Again, we know that this is hard and this is tiring, but every mask, every vaccine, every attempt to limit gatherings is important. As the proverb goes, it takes a village. In our case, it will take the entire state. We have a common, absolute responsibility to protect our children, be they our own or our neighbors. Please get a vaccine for your child or grandchild. Wear a mask for the kid down the street. We all want what's best for children, and we all need to play a part in their success. Finally, your children's hospital has been taking care of kids and families, all kids and families, for more than 100 years. It will take all of us to fulfill this promise both now and into the future. Thank you so much for your attention, and I'll pass it back to Governor Brown.
Thank you so much, Dr. Brainer. I am incredibly grateful for your service, and I know I speak for Oregonians across the state. We are so grateful for the dedication and service of healthcare workers around the state to keep Oregonians safe and healthy and alive.